My name is Emeka Obiora, and I'm a surgical oncologist. I did my undergraduate education at University of Michigan, and I went to medical school at Wayne State University in Detroit, Michigan. Following that, I did my residency with the Temple St. Luke's system in Pennsylvania, and I proceeded on to my surgical oncology fellowship at Wake Forest Baptist Health in Winston-Salem, North Carolina. A surgical oncologist is a surgeon that participates in the sort of treatment plan and cancer care of all patients that are diagnosed with cancer. This can span anywhere from the GI tract, in other words, the gut, the liver, pancreas, and biliary tree, and other parts of the body, including the abdominal cavity and other areas of soft tissue. Initially, my exposure to medicine came at a young age. I had my father that had a younger brother of his that was diagnosed with liver cancer. That was my first exposure to sort of the comprehensive care that was involved in treating patients that were diagnosed with cancer. That was my first inspiration. And what I long discovered after that was that a surgical oncologist plays a central role in the care of cancer patients by way of using surgery as a tool, amongst other tools, in the care of cancer patients. One important thing that I've learned over the years is the importance of food and nutrition, and then also the importance of movement and exercise. So those are some of the basic fundamentals I share with my patients. In the era that we're in now, there's a lot of mechanization with food production and ultra-processed foods, which is part of the landscape of what we have to consume. So what I do encourage patients about health and the importance of what they do is to consider those things and try to avoid those as much as possible, because those have significant consequences for our health. Also, movement is important, as well as fitness, which I also educate patients about, that it's important to start with small steps and also consider doing that as part of their treatment care plan. I enjoy things like sports entertainment, music entertainment, Broadway shows, plays. Those are some of the things I do to pass free time. If you would like to make an appointment with me, have your provider make a referral.